Okay. I'm gonna start now. Okay. All right. Hi, everyone. It's Tosi, and welcome back to Criado's podcast on this segment of Convos with Caregivers. Um, I said this last time, but I'm just gonna tell everyone again kind of who caregivers are in this context. And yeah, I think that's important. So, how we define caregivers is we really mean the ones who show up for our community. So, caregivers are the doctors, doulas, community builders, healers, and heart holders who care deeply for our community. And in this segment, we sit down with them, those people who pour into others, and we ask them about their stories, their why, the wisdom that they've gathered along the way, because we're trying to create a really nice network here for our people. So I'm really excited to have Jaylen here. So Jaylen was born and raised in San Jose, California. He earned his undergraduate degree in kinesiology and sociology from Texas A&M University, where he was a track and field student athlete. The last person we had on here was a student athlete too. I was a student athlete too. Shout out to the student athletes, right?
Together.
I love it. He then attended the University of Texas at Austin, where he earned his master's and PhD in health behavior and health education with concentrations in multicultural counseling and qualitative research methods. After completing his degree, Jaylen received his postdoctoral training at Boston University School of Medicine in the Cardiovascular Epidemiology program and at Boston Medical Center in the Department of OBGYN. I'm going to abbreviate that. As a behavioral scientist, Jaylen's work utilized health equity driven and community slash people centered study design in order to better understand stress adaptation, evaluate cardiovascular health interventions, and qualitatively explore the complex and unique health outcomes, behaviors, and experiences of marginalized communities and their families. Jaylen currently serves as advisor for science and health advancement in emergency cardiovascular care for our National Center at the American Heart Association and International Liaison Committee on Resuscitation. Wow, you have many big words in there,
I'm
Jaylen.
just saying, I said, oh
I'm
wow.
so proud that I read all of that. I'm not gonna lie to you, but you deserve all of those accolades, okay? You deserve it all. Um,
Even so it's being read back to you, you're like, oh my goodness. Who
no.
is that?
Listen,
I
you worked hard and we about to hear about why. So thank
I
you so
love it.
much for being here. And I'm so excited to dig in and learn more about you and why you do what you do.
For sure. I'm so excited.
Uh-huh.
Thank you.
Yay. Okay. The first question is I want to get started with the human behind the credentials, right? So I want to know who Jaylen is behind your titles, behind your degrees. Who really are you?
Well, after hearing them told back to me, said back to me, I get to sort of ground myself in the reminding and the memories of like, okay, these are all the things that really did lead to like where I'm at right now
Mm.
today. And just again, hearing it out loud, I'm like, that's still crazy. When it's back to me, because I think we just normalize it all like from
Yeah.
our day to day. So that's the human side is that like every single day I get to live what I think I've normalized, but it's a incredible
Mm.
life. It's an incredible professional career. But the person behind it all is like born and raised San Jose, California.
Hmm.
And I come from like a really close family. I have my mom, my dad, and my sister. My sister's about 3 years older than me. And we
Mm.
are like this. She just gave
Yes.
birth about a month ago, oh, actually 2 months ago. And so
Mhm.
I just became a first-time uncle. That's who I really
Oh,
am now. I'm an uncle now.
yes.
Uh, and I got to spend the first 6 weeks of her postpartum period with her and my
Mm.
little niece and brother-in-law and everything out in Alabama. That's where they're stationed currently.
Hmm.
Um, but and that was one of those experiences that I think just put the work that I'd done, like all that kind of stuff, but it really put it to practice. I got to be not
Yeah.
only just like a brother and an uncle, but also like a little bit of a caregiver practitioner in terms of like having all those parts of me really just be needed at one
Mm.
time. And so making space for that is kind of how I would define like the life slash career kind of thing is I just love, I love people. I
Yes.
love health. I love putting people in their best position to make good choices about their health,
Mm.
and putting myself in a position to help them do the same, like help them do that. And I'm not like one of those folks that assumes that everyone needs my help. I'm one of those folks that like, I just like to listen and I like to reflect back to them
Mm.
what they're saying to me. I think when people are able to like share with you what they need, it allows them to sort of also process out loud what they need and like learn a little bit more about how to ask for it. So all that really comes into yeah, what I do with my day-to-day sort of job, but also how I treat my friends and how I treat the
Yeah.
my mentors who are in my life, mentees, because I've had so
Mm.
many wonderful students as well along the way.
Mm.
And yeah, but keep with the questions because I know I'll start. Oh, yeah,
I
yeah,
got
yeah.
you.
I'm
No.
like, I could go a lot of directions with all of that, but I'm passionate about living, and living for
Yeah.
myself and for others. It's an incredible privilege.
Yeah. I'm so curious. You are like a ray of sunshine on screen. Like you just seem like a pure human. I'm so curious. Did you always know that you wanted to go this route of like research, but practice, but heart health? Like how in the heck did you find your way to where you are? Because I feel like there's not a lot of kids who say, I want to grow up and do research about, unless that was you. That could have been you.
Oh, I'm like like you could almost ask all of my friends. I'm such a like a okey doke kind of person. I'm like, and that nature to myself, like had to start young, because like in terms of going with the flow, there are so many things that I could not go with the flow with when I was younger,
Mm,
because all of my life has just been so structured in terms of like being an athlete when you're little, and then growing up with that, and then with school, I got diagnosed. It wasn't until like high school, but being
mm,
diagnosed with the learning disabilities and the processing disorders and
mm.
the OCD and the ADHD and all these different items that made like the education space and academic space so challenging
Yeah.
for my entire life, and then pairing that with sports to help like have a little bit of structure in there. um, School was just hard, but learning was something that I had to figure out, how I learned best. So when I say that I can look back and be shocked by just my education, my training, my all that kind of stuff,
Yeah.
I'm so serious because I also had to be in special education growing up. And I had to take
Mm.
classes that were in the library and classes like before school and after school and summer classes.
Wow.
I was never someone that was like, you could say on paper was good at school. I
Mm.
didn't get to figure out the best way how I learned until I was paired with like a learning specialist and like having special education classes to help me learn how I learn, and using like what works best for me and figuring that out like through high school, through college, through grad school, master's, and then grad school, PhD,
Yeah.
and still to this day, but I figured it out by the time I got to like midway through college. But academic probation, that was something that happened in
Wow.
like high school, happened in college and all that good stuff. Even happened during my master's, but it's not for a lack of trying.
Yeah.
It's for pretty much like that trying just not being enough sometimes. You can have the tutors, you can have all that good stuff.
Hmm.
So I say that like I never planned any of this. I think I became an okie doke kind of person because I'm just like I gotta live this life 1 hour at a time, and
Yeah.
sometimes figuring out that like okay, we're gonna need to pivot when it's necessary, and
Mm.
getting better at pivoting. Just became better for my health, better for my trajectory, being more open and not closed off.
Yeah.
Where I'm at now in terms of the health, and how I got into this work was, I think, truly started when I was my like senior year, between junior and senior year, but definitely senior year of high school.
Mm-hmm.
And I was training with my track coach, my hurdle coach,
Mm-hmm.
and
Wait, what did you run? What did you,
oh,
hurdles?
I was a hurdler, full
That
blown,
is
110, 300 hurdles in high school, 400 hurdles in college.
that is
Um,
terrifying.
yeah,
They tried to have
and then
me
the
do
110.
hurdles.
One more time.
They tried to have me do hurdles. I got too scared. I ran around. I said, "This isn't for me. This track, this is not, this is not for me."
Like, no, 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 no,
Wow.
no.
I love that. Okay.
It was, and the hurdles for me were just probably like my first just love.
Oh,
I did every sport under the sun. And my dad had to like drag me out the house every time for
really?
every practice, every game. I said, oh my gosh. It was I feel, I mean, the way that like we get to laugh about it today, but
Yeah.
my sister
Yeah.
was just pure like wanted to always train and be out there. She was great.
Mm-hmm.
I obviously athletic, great, but didn't want to be there
Yeah.
until track. And so track was truly one of those things that like, ooh, like this, you don't, no one ever has to tell me to do anything. I was dragging my dad out the house to try to get
Wow.
to the track and get to like start early, be the last, like first one there, last one out. But with all that, my senior year was working with a specific like hurdle coach, my hurdle trainer, and he helped me just like pair together these thoughts of like how everything is sort of linked. That my
Mm.
health, that my health and my nutrition, the way that I lifted, the way that I slept, and everything was just my mood, and my attitude and all that kind of stuff. They're just linked and paired to my and technically connected to my performance. And so the better
Mm-hmm.
I got at those things, the better I'd perform. And it would just be this like cyclical nature of like, and the better I perform, the better I want, like the more I want to do this stuff and do better at it.
Mm.
I'm like, what the heck is going on? Like he helped me find control in an uncontrollable environment because you can't, like, you have to run your own race. You
Yeah.
can't start looking around. You can't start feeling like you're running somebody else's race. Like this was one of those situations where like he helped me find stability, or he helped me help myself because I'm like he
Mm.
always tried to tell me that he didn't do anything as a coach kind of thing.
Yeah.
He just sort of like tried to guide me, but I had to do all the work. And that has just
Yeah.
gone into like the rest of my life is like as long as I have like the guide, like the guardrails and
Yeah.
as much support as like is feasibly possible, I'm like, I can kill it. Like I can really do this. But I
Period.
still need all this stuff. I'm like, oh no, don't leave. Give me them
Yeah.
training wheels for a little bit.
So
But once I
that,
got it, I got it.
yeah, no, that's awesome. So I'm curious, is that kind of what sparked your interest into like health in general, was working with that coach?
Working with that coach, that was the first time it clicked for me.
Mm.
Even though like sports and track and all that kind of stuff had always been like inevitably all about the body and the health and all that good stuff. Even though
Yeah.
once I got to college, I'm like, athletes aren't the healthiest people.
No, correct. That's a very correct
I'm
statement.
like, this is actually a very unhealthy environment if you ask me.
Correct. Correct.
But so my coach just helped me make those pairings that like I have a
Mm.
lot of control as to not just like the performance feel, but like how I want to feel when I perform. Like yeah,
Mm.
I could run like get a PR in these times or just continue to improve along the season.
Yeah.
But if I'm running hurt or if I'm running stressed or if I'm running, like in a dark place, or if I'm
Yeah.
running in a happy place or a joyful place. All these things are just so interconnected that I had to learn to listen to my body. And the moment I started to get really into that,
Mm-hmm.
I'm like, I think I want to help other people do that, like help other people make those
Mm.
connections. So by the time I got to college, and failed all these business classes. I'm like, okay, maybe I don't need to do this. Maybe I should be in health. So I had a conversation with my advisor for that. And she was like, okay, but what are you in business for? What do you want to do? And I told her I wanted to
Mm,
have some type of like health focused like business, like health and
mm,
working with people, working with whether it's athletes, performance kind of stuff, or just healthy
yeah.
behaviors, things like that. And she said, then why are you in business? And I talk to her to this day. That was more than 10 years ago. I
Oh,
talk to her to this day and tell her that if she had never made that connection for me, I'm like, I don't know what the heck I'd be doing. Um,
yeah.
but she helped me make the connection that like I didn't have to major in business because like I wanted to make a business out of like my health interests and things like
Yeah.
that, health and body interests. So she told me right then and there, like, oh yeah, you should go apply to be like a kinesiology, like health kind of student,
Mm,
sociology to get like that community health kind of aspect and feel to it. And that's exactly what I did. And I went from academic probation and not passing classes at all
hmm.
to nothing but A's and B's.
Wow.
And I said, so this whole time, I just had to be interested.
This whole time, that was the secret, and no one told me
I just had to like it a little bit.
that.
And even when you like
Wow.
it, it's hard, but you're willing to study in a different way, like because
Yeah.
your motivation is something different. So the way that
Yeah.
I got to find out that I'm not bad at school,
Mm-hmm.
and even if school isn't easy, I think I love learning. And learning
Mm.
is so much different than just being in school and classes. Like
Yeah.
I was obsessed with learning now. And by the time I was done, I'm like, I'm not fit. I don't want to be finished yet at undergrad. So got
Yeah.
connected with one of my professors who was the first Black person, let alone Black woman that I met with a doctorate. And she introduced me to like what grad school is and like you can keep going and
Mm.
like this is what a PhD is, this is what a master's is. And she walked me through that whole process.
Yeah.
And I eventually met amazing folks here at UT that were also Black PhDs. And I
Mm.
was like, I've never been in a space like this. And I knew I had to keep going. And they said, the second you get here, we got you. And the second I got here,
Wow.
they made sure that they looked out for me every step of the way.
Oh,
In this country and other countries, like they made sure I traveled. They made sure I had
period.
all the experiences possible under my belt to show me that like you can get these three letters behind your name, but it's not to do
Mm-hmm.
just like one thing or like either teaching or research. Like
Yeah.
once you get those three letters or multiple letters, like those are to
Yeah.
open doors, not to limit yourself. So uh,
Wow.
that's enough.
No, I love it. No, that was so good. And I think it paints the picture because so many people, well, I'll speak for myself. I don't want to speak for everybody. I I didn't public health was a new world to me. I didn't know that was a thing. Or else I think I would have found my way here way earlier. Like I didn't I didn't
Right.
know that was a thing, but I think your story is so inspiring because cards were stacked against you a little bit. It
Mm,
sounded like it, but with with what you were saying, the support that you had and the determination that you have, you didn't say that, but I'm saying that of like, you know what? I actually like learning. So I know I may not be doing so great right now, but I'm gonna just keep going. Okie doke. I'm gonna just,
well,
I'm gonna just keep going, 23.
you got
Okie
it.
doke, not for me. I'm gonna go this way. That's fine. Like I think it's so inspiring and I think there's a thread. I'm finding a thread the more I have these conversations. Those who work with humans
Mm,
and who are caregivers for the world
mm,
oftentimes had no idea where they wanted to go, but they just were following what felt right in them. Like
mhm.
that's so cool to me. So I know you said that's enough, but I'm gonna ask you more questions.
Wait,
I'm gonna ask you more.
give me like a little ring of the bell, like, all right, we gotta pivot because
I
this
got you.
is
No,
this
this
is
is
one of those
fun.
things.
This is exactly what we're supposed to be doing. This is so fun. Okay.
Love
So
it.
my next question is, this is one that I've added that is not on the pre-list that I sent you, but I'm so curious. Working with cardiovascular health, and it says that you worked also in the department of or OBGYN. I feel like there are never men, black men in
Mm,
those areas.
mhm.
How did you find yourself there, and what was it like being in those areas? That's a good one.
I was about to say it. You're about to hear a process.
That's okay.
Um, so I will say like it does start from like a situation that happened when I was in my I think about to go into I just became like a doctoral candidate, I believe.
Mm-hmm.
So in like entering into my last phase, dissertation phase of my PhD,
Mm-hmm.
um, I was working with, I was working on an NIH grant,
Mm-hmm.
and this is one of those grants that focused in on teaching resilience-based diabetes, type 2 diabetes education classes through the Black
Oh,
churches in
cool.
Austin. And so what that meant was that involved about 30 churches or so, about 30 or 300, about 30 churches, but 300 individuals who
Wow.
would soon be be a part of a 2-year diabetes education class
Wow.
or program that would be like classes that are like once or twice a week, depending on which area, like lane you were in, but
Mm-hmm.
once or twice a week for those 2 years, and and those included also like having support groups. So, anyways, all of that, I got to be not only like an educator in that program,
Mm-hmm.
but also like the community liaison, and I got to
Mm.
learn so much about the not like the people in general who we were serving and serving as students, but the women specifically that were doing a lot of the groundwork in their own churches and communities to make sure people got into the program. And
Okay.
most of the program was like probably 75% Black women. Um,
Mm.
and what that allowed me to be able to like observe and do was listen. Like we were talking earlier,
Yeah.
was just listening and listening to their stories and
Yeah.
how they and like how they when they got what was their diagnosis story when they got diagnosed with diabetes, how it's been since then, what their journey has been, and
Mm-hmm.
imagine listening to our just hours and hours and hours,
Yeah.
and absorbing it and taking it all in and hearing, like you're saying, like this commonality and this thread of traumatic experiences or
Mm.
finding out at this stage. There was so much that people found out at the while they were pregnant, and
Mm.
learning about like the type of care that they either received or didn't receive during their pregnancy, the
Yeah.
education that they either received or didn't receive during their pregnancy, if the doctor took it seriously, or if the education materials that they received were even helpful, or what kind of materials they
Yeah.
received, but how gestational diabetes ultimately, if goes untreated or not treated appropriately, developing into type 2 diabetes, and that just becoming like a lifelong
Mm.
diagnosis for something that could have been just like term related.
Yeah.
Um, and it was blowing my mind because to know
Mm.
that, again, I was making these connections with the human body and stress and cardiovascular health as a whole, but learning from them that, like, there's so much of this that wasn't a choice, that wasn't like a
Yeah.
decision or a behavior. It were things that like happened
Yeah.
to them, and then continued to just exacerbate with like each of the day-to-day sort of stressors that come, or life things that come, and habits that continue to be now formed because of this
Yeah.
diagnosis. So finding out and learning a little bit more about that. Um, that was what was the core of like my interest. It wasn't
Yeah.
until in 2022 that I myself ended up in a hospital, because they and I had my own sort of a healthcare um, traumatic experience, and I'm okay to talk about it
Oh.
now. Um,
Okay.
and but it was one of those things where I ended up I ended up like going and seizing in my
Oh
apartment
man.
complex, and no, like no one was home, and I had
Oh
to sort of like
no.
find my way out the door and get to like somewhere where I can be seen by an ambulance that was being called by my mother in California
Oh
because we
my
were able to get her
gosh.
on the line. And I eventually, got strapped down to this table. And I apologize if this is maybe triggering for anybody else who may be listening for this
Hmm.
story, but I also want to give voice to these types of stories because this was my
Yeah.
motivation, so I don't want to like dance around it.
Yeah.
But it was my experience of being like strapped on that table. I had an inability to speak, to move, to
Mm.
advocate for myself, to do anything. And I actually got admitted into like a psychiatric ward because they thought I was in there for a drug overdose,
Oh
or
my
a substance
gosh.
overdose. So I was
Oh
put
my.
into a back corner in a hallway of the hospital that I was in, of the ER, and like monitored by police officers in the hospital, and basically like just cornered and wasn't being, talked to for hours and hours and hours.
Oh my gosh.
And they were saying they were that I wasn't being like communicative and telling them that these were not drug related. I had an inability to speak, so I couldn't open
Yeah.
my mouth. So, but by not responding, they were saying that that was me like not being compliant. And so I'm just like I
Yeah.
can't talk. And what happened was that and a few hours go by, and my mom was able to get in contact with my friend who's in
Mhm.
Austin. One of them, Mickey, and
Shout out
Washington.
to Mickey.
Mickey Washington, yeah, she is incredible. And she came and basically said, like, I'm his sister. I gotta find him. Da, 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 da.
Yeah.
Eventually let her find me, and it wasn't until she told them who I was that they ran their first test.
Oh my gosh.
So hours in, she says like this is a PhD like student candidate like at UT in this department, blah 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 blah. Like he's the healthiest person I know. He hasn't done a single drug or blah any of all
Yeah.
that. She shouldn't even have to, but that's what she advocated for me.
Yeah.
And it wasn't until then that they ran their first test to try to figure out what was going on. And they basically from that moment like ran their test, had me all
Hmm.
wired up. My mom flew from California to Austin, got
Yeah.
me, and in that moment they moved me up to like some nice area of the hospital after that because they felt terrible. Um,
Yes.
and all that to say that entire experience, because I was in there for about a week or so, I couldn't walk, I couldn't move, I couldn't
Oh my
talk. It was
gosh.
in I could just kind of move my eyes, but I knew from that moment on that if I were able to survive this situation, like I would make sure that the rest of my life is towards like every word that I uttered, every sound that I make would be to advocate for others who are
Wow.
in this type of position or to make sure they don't, and who's the most at risk or vulnerable to be in this type of a position. And it was pregnant and birthing people, and women,
Yeah.
and that changed everything. I was like, I'm gonna make
Yeah.
sure that this is not only do I like there are so many individuals that I've worked with within the OBGYN department or just in maternal health in general, and the Black communities in general, like they don't have to hear my story for them to
Yeah.
be seen and heard. And I kind of make it a point to like no one ever knows that that's my motivation.
Yeah.
But that truly is my motivation to be able to make space for those who have the very similar and worse stories
Yeah.
in healthcare settings, hospital settings, clinical settings, and to make sure that even if it's not avoidable in a lot of capacities, that we make space to at least process and talk about it, and
Yeah.
learn and figure out how to, heal through it.
Oh my
So
gosh.
that's it. That's how I got here. My work I do today is different, but
Yeah.
that was what started this trajectory of ending up in the OBGYN department, and really
Wow.
taking like a macro type of issue with cardiovascular health and
Yeah.
saying like getting it all the way down to the person, like Like, yeah, we have all these statistics, but every single number represents a person. So what is that person's story?
Yes.
Yeah. The
And that's
story is
huge.
everything to me.
No, thank you so much for sharing. Thank
Of
you.
course.
That's a lot of
Yeah.
trauma, of processing, being able to tell your story, connecting it to kind of your why of like taking this journey. And when you start speaking about pregnant, no one who knows me is going to be surprised. You're speaking my language. I love
Mm.
moms. I love babies. I and I don't have a story like yours by any means, but what I grasp is that one of the
And I
most
hope you never will.
I hope and I yes to that. Um, but pregnancy and delivering is one of the most vulnerable times
Mhm.
in a woman's life, in a human's life, is when you may not have auditory, you can't speak. The pain level that you're in is people compare it to dying. Like
Mm.
there's so much vulnerability in that state. And to not have support, to not have people advocating for you or simply listening to you, like that. And then there's all these other complications that happen because people aren't listening or because you aren't educated on certain things. So it compiles and compiles. I could talk about this for hours. I love
Oh,
this.
why? Yeah. Of
Yes. Yes. So thank you so much for sharing that.
course.
And we need people like you who care so deeply about people like us who may
Mm.
not look like us, i.e., you aren't a woman, but
Didn't even connect it all. Oh my gosh.
what, you need to connect it?
No, I didn't even mention the part of being a male in it all. Like it was
Oh,
just like, but that was part of
that's
the
okay.
question.
We can come back to that in a second.
I
This
love it.
time is ours.
There we go.
But no, but like the fact that you aren't a woman, but you have this deep desire to help and listen to, create spaces for, advocate for women is so huge because there really is. Okay, I'm gonna get off my soapbox in 2 seconds because this is
Please.
your interview. This is you.
I know. I'm gonna dive into. I was like, what else we got over there?
No, but we've been dabbling because at Criado we really focus on the birthing person, the woman,
Right.
um, which is necessary. It's very necessary to create spaces where they feel comfortable. But there's also this lingering bubble of, well, the woman could be by herself. And in that case, what support could she have, i.e., a doula? Medical providers actually should be the ones providing help, but that's a whole nother conversation. But if she has support from family, how are they educated on how to support for her, advocate for her? And so I talk about this personally, like with my husband. I listen, you about to go through a school when I get pregnant because I know I'm not going to be literally I know I'm not going to be the one that can advocate for myself at all times. It's going to have to be you, and I want to feel comfortable that you know exactly what the process is, what the complications for XYZ are, what it is that I want so that you can communicate that with others. So I think it's so
Mm,
important for men to be in this space,
right.
um, even if they don't want to be a dad or they don't want to like like being an uncle, being a brother, it doesn't,
Hmm.
you don't have to be a father or be looking to be a father soon to have these type of conversations for the women in your life. So,
It's just about being present at that point.
yes.
Visibility is an incredible offset to so many different medical treatments, and how we receive or how it's even conveyed to a patient or a person who's receiving the
Mm,
recommendations and the treatment. Somebody else's, and that's as unfortunate as that may feel and seem, like
mhm.
that's one of those things that with what we've been given, like these are some ways to approach, and it's like having some, and it is a privilege if that's the type of support that you have access to, but
Yeah.
somebody else's visibility as an advocate, just being in the room can do so much in
Mm,
terms of how a person is given treatment recommendations.
yeah.
It is incredible. Yeah.
Yeah, no, that's so true.
Yeah.
Um, oh my gosh. I don't want to end this conversation. We're gonna have to have a part two already, okay?
I'm so sorry.
No, don't be sorry. This is great. This is great. I'm gonna move on to one more question, I think. We'll see how much we have time for. But
You,
um,
not you.
so okay, yeah, I like this one. What have you learned? And this is kind of going back to the work you do now, I think, more on like heart health, stress, those types of things. What have you learned about Black and Brown communities and how they adapt to stress? And how can we begin to move from survival to restoration? It's a
Ooh,
big question.
okay. And I'm probably gonna ask for that the beginning of that one
Okay.
again. Okay.
What have you learned about how Black and Brown communities adapt to stress?
Wow. Yeah, this is one of those that I it's like I think it's a constant learning about it. Because when I think of Black and Brown communities and how we're told we adapt to stress, we have this
Mm.
tendency to sort of think through how strong we are and how resilient we are. Um, and we are just as vulnerable as everybody else.
Mm.
And everybody is just as vulnerable as us.
Mm-hmm.
And not in the sense that some people are not in predicaments and life situations and environments that are in like less safe environments or less privileged areas and spaces and environments. But when I mean that like how Black and Brown communities adapt to stress, it is like everybody else. It's like it helps us to know that we are not a monolith. It helps us to know that the way that we should be learned about and studied shouldn't have this sort of filter that we have this super ability to do it.
Yeah.
I think the way that we navigate it is going to be unique to where we grew up, like how we grow up, our family dynamics. Like
Mm-hmm.
if someone is trying to adapt to a stressful event in their life, some like an individual may lean more on social support. An individual may lean
Mm.
more on the like a family and what resources they have within that. But self-driven, like and like resource gathering, information gathering, where hey, maybe I'm doing that for myself, but not because I don't think I have support and people in my life. That's just how I'm more
Mm.
comfortable adapting to the stressors in my life. It could be a control thing, it could be a familial thing, a community thing, a one-on-one
Mm.
type of person, like just one trusted person. If I have a doctor in my life who looks like me or sounds like me or acts and has mannerisms like me, maybe that's the one person that can help me adapt to this stress. I'm not doctor, therapist, anything like that.
Yeah.
Um, it could take one person, it could take a village, it could take yourself. All I know is that what I've learned is that there's no one way that we do
Mm.
it. And I think we're at a disadvantage when it comes to clinical research and research in general that dictates how people talk about it when
Yeah.
we think through that, like, oh, this is what we should do because it is a Black and brown community.
Yeah.
Like this is what they like, this is what they are more receptive to. And it's like there's truth to trying to generalize in a way to provide some set of resources to
Mm.
support. That's so understandable. I come from an entire, you know, educational background that specializes in that. Like you have like
Yeah.
community health, you cannot have like if you have a community of 1,000 people, you cannot like, be able to cater to every single one aspect of like this person adapts in this
Yeah.
way or needs these resources. And so you do try to provide for the greater good.
Mm-hmm.
But as my own kind of a caregiver and practitioner kind of thing, and how I like to approach it is meeting people exactly where they're at. And even like these
Mm.
individual people make up a community, and these individual people have their own stories. Every pregnancy is different. We can find the
Yeah.
commonalities in a pregnancy, but if I'm meeting this pregnancy and this pregnant person and their journey and knowing their history and their future and their overall just how they process and think through their own stressors in life, if I'm giving all these generalized knowledge and treatments to or treatment recommendations to this one person without considering all that stuff,
Yeah.
then that's putting them in a position to not even know how to ask even further questions that have to mainly do with themselves. Like give them an opportunity,
Mm.
give Black and brown people opportunities to tell you how to treat them as a
Mm.
person. I think we all should find out more and more ways to like come together as a
Yeah.
community to build resources. Um, that's beautiful. I think that's how we've made it this far in this life, and in is our histories, our shared histories. But I think moving forward, better, faster, stronger, all that good stuff,
Yeah.
we'll be together, but also making space for like our individual differences and knowing that blackness is not one thing.
Mm.
And there's so many ways that we live it every single day. And there are different filters of, the Black experience. And I think we deserve to have a little bit more of a
Yeah.
complex way to think about us.
Yeah. Mic drop. Literally. No, I think that's a huge and really, really good point. And when you get into public health and community health, it really is like Black and brown communities statistic, Black and brown communities statistic, which are not false statistics, which we need to think about, but
But how
it
they're
does,
gathered. Hmm.
yeah, but it does take away the individuality of being a human. And like,
Hmm.
yes, I am Black, I am brown, and I am Tosi, or I am Black, I am brown, and I am XYZ. And as Tosi, who is a Black and brown woman or person,
Hmm.
this is
Hmm.
what I need, which may or may not be what my sister, who is another Black woman, may need because she's Lade and she's a different
Right.
human than me.
Right.
Yeah.
And just to like piggyback off of that, it's like this conversation, and I think when we're talking about um, diabetes or heart disease and things like
Mm-hmm.
that, cholesterol, high cholesterol, these are things that when we do see statistics or we do look at this research or empirical studies and clinical
Mm-hmm.
trials and all these different works of data that have been collected over time, there is this like not only the tendency to just sort of see a monolith forming within communities and how we think about the community health, or the
Mm-hmm.
particular community health, but when we end up we do a disservice when we like generalize
Mm.
all of these items to say that Blackness is a risk factor for diabetes. Blackness is a
Mm.
risk factor for having high cholesterol, a risk factor for uncontrollable blood sugars and things
Yeah.
like that. And it's like blackness is not a risk factor. That should not be the correlation that we are finding in empirical and clinical studies that
Yeah.
lead to diabetes. Me being Black should not equate the experience
Yeah.
of getting diabetes, or forming and type 2 diabetes and things like that. So
Yeah.
that's where I get into my, soapbox kind of thing because the research absolutely creates a foundation and a base as to which to, enter the
Mm-hmm.
conversation and learn a
Mm-hmm.
little bit more about the habits and behaviors of an entire community and how to meet them where they're at by their zip code or environment or
Yeah.
just overall structural identities or structural environments, physical, mental, emotional environments, things like that. It allows us to open the doors into
Mm-hmm.
those conversations, into those people, and those spaces for that we want to reach them in. But but when we go to report on that information and we start to
Yeah.
say that in order to like make these correlations sound as powerful as they are and get more funding and research behind it, and show the
Mm.
effects of our intervention or the program and the benefits that they got from having it, then the only way we can prove that is by saying that we offset this sort of like what we couldn't control for was the risk that
Mm-hmm.
of being Black. um
Mm-hmm.
and that's the interesting piece because it's we can't do anything about that. We can do
Yeah.
some things about some behaviors, some things about some financial aspects of it. when it comes to just like overall knowledge, education, forming, affordability, things like that.
Hmm.
Those are things that can be changed, that can be impacted, or can be manipulated in terms to get better outcomes. But to say that those are not risk factors, or say that within those risk factors that our identity as a Black person or Black
Yeah,
people is kind of a determinant of health.
is not
Not a
fair.
big fan of that one.
Yeah,
But I'm a human being in the field, and I'm open to the conversation. It's the dialogue that
yeah,
allows us to move forward. And so I'm happy to continue to that dialogue with anybody and everybody
yes.
who has another opinion. But I do believe in that's the statement of it all that
Mm,
we as a Black and brown just sort of people is
hmm.
not a risk factor or a determinant to our health outcomes. Shouldn't
Yeah,
be.
I love that. I love
Yeah,
that. Okay, and I know we're at time, but can I ask you one more question?
please do.
Okay, I just have one more question, and um, there's no right or wrong answer to this. Have you heard of the term body literacy?
Body literacy. Let's say no.
Okay, so if you had to, because you're a very smart person, if you had to try to say what you think the definition of body literacy is, what would you say that that is?
Well,
No right or wrong answer.
hey, I will feel my way through it because when I think of health literacy,
Hmm.
it's just our accumulated knowledge about the some things that are just all things that are health related and relevant to us.
Hmm.
Health literacy may mean knowing a subset of how to like the education behind type 2 diabetes, for example.
Hmm.
My ability to be health literate when it comes to type 2 diabetes education is knowing the terminology, knowing some of the
Hmm.
practices, the behaviors, the habits. How did I end up with type 2 diabetes? What
Yeah.
does that mean that's going on in my body? What does that mean, like for the rest of my life, what I need to do to manage it?
Yeah.
So a lot of that just comes from learning the language around what's related to maybe my health outcome when it comes to health literacy. So if I think of body literacy in that same
Hmm.
format, it would be I think it would be self regulation and self learning around like like knowing my body and pretty much being literate in my body and
Yeah.
how it responds, how it reacts, how it copes, how it
Hmm.
heals. I think that would define much of my work, but also my choices. Is my body literacy the way that I'm able to be sort of okie dokie and go with the flow is because
Yeah.
every decision and behavior and habit that I have intentionally believed to have formed is because I listen to my body. I listen when I'm tired. I listen when I'm
Mm.
energetic. I listen to my energy and the people around me that reflect sometimes how I'm looking and feeling.
Hmm.
And it's just being present and mindful of how my body, like what my body is going through when it's going through it and why.
Yes. That was a great definition. That
Super guess.
no, no, that's great. So like I personally, Tosi and Criado, body literacy is some like a term that hasn't quite been defined. It has been defined by certain people,
For
but
sure.
I just want to get everyone's perspective on it because how I see it
Hmm.
and how Criado sees it, which is why we take certain approaches to doing what we do, is exactly what you said. If you can learn the language of your body, right? Like, what
Mm.
is your body telling you? Reading and understanding
Mhm.
what it is your body is saying, it kind of takes away, like how you talked about, there's a monolith of the Black community. Well, when you start to do your own body literacy, the way that you cope with stress, the way that you cope with or the way that your body tells you something's off balance, maybe hormones or something like that,
Right,
you
right,
will
right.
start to connect it in a way where you remove yourself from the monolith and you become a person who knows how to
Mm,
advocate and knows what support you need for yourself.
I need. Hmm.
So yeah,
Hmm.
so your definition was fantastic.
And
And
they won't put it in a book. It's too long. But
but we love it and it
but we
was
love it.
great.
Chat
Um
GPT, summarize this into like one
literally
sentence.
literally that, literally that. Well, this was so great. I want to honor your time. We're a couple minutes over. I have loved talking with you.
Love it.
I want to do a part two. I also just want to
Our
chat with
sister.
you more about so many things.
Please.
Um, I don't know if people have questions that they want to ask you, if you want to give any information, or if you want to direct them to Criado, and then we can reach out on that behalf. But if there
Be
is
wonderful.
if there is a contact, or if you want to defer to the Criado, let us know now how people should ask you questions if they have questions.
Absolutely. I think streamlining it through Creata would be incredible. It allows them to also reach out to y'all as a resource and then
Hmm.
through me to be the resource.
Yeah,
So keep that motion going. I love it.
I gotcha.
But yeah, I would love to continue talking and have more conversations because that's
Yay!
all I
We
do.
like to talk. I love it. I love it. Okay. Well, that's it. Thank you for
So,
coming. Thanks for chatting, being vulnerable, and
thank you.
thank you for the work that you do. You're amazing.
Of course, this is why it's the heart work, truly.
Yes,
For
literally.
sure.
All right. Thanks,
So,
Jaylen.
thank you. Have a great rest of the day.
You too. Bye.